Council in Legislative Session 2024-04 for February 20th, 2024. First item on the agenda is the Everside Health Proposal from the administration. I'll give you the floor. Thank you.
Pam Oland, Finance Director, and I have with me Mark Schubert. So since this has been presented to Council, Everside has agreed to merge with a company called Marathon. So Mark is continuing on with the company, but I will let you tell him. I'll let him tell his title since I don't remember it.
Good afternoon, everyone. Mark Schubert with Marathon Health. I am in charge of our growth across the Mid-Atlantic and Northeast region. So have been with Everside as an organization for over 2 years. As I know you've gotten some notes, we've put in health centers in some other places throughout the state of Maryland and of course across the rest of the country as well. We've got around 680 total health centers. I'm very specifically focused on our growth in the Mid-Atlantic. I'm a native of Maryland myself. In the last year, we've been able to put in health centers with Queen Anne's County and public schools, with St. Mary's County and public schools, Washington County public schools, and then of course Wicomico. And excited to be here to talk to you a little bit more about how we could partner with you all.
So back in February, March of 2023, Everside came to the Healthcare Consortium, which is a partnership between the Board of Education, the Wicomico County, and the City of Salisbury, to talk about their product. I was very intrigued. Some of you may or may not know my background. Prior to arriving on the shore, most of my background was working in healthcare. And so I worked as a consultant for healthcare. I worked for healthcare companies, and this product actually very much excites me for our employees and for the county on a cost basis. This product would be, we would partner with the Board of Education, who is already assigned with Marathon, and I'm gonna screw up and say Everside a couple times. So I apologize, because I've been thinking about them as Everside for over a year. Board of Education is opening a location within the City of Salisbury to provide for their employees this model. This model is Marathon comes in, sets up a location, and basically staffs it with providers that the employees of the company, and in this case the Board of Education, have a telephone number, and they can call them and they can utilize them as their healthcare facility. They can use them as their primary care, they can use them for certain specialty care, they can use them as their pharmacy for certain generic drugs. And the benefit to the employee is, instead of going through your health insurance, there's no copay. So right now with our health insurance, our employees, if they go to a primary care physician, or they go to a urgent care facility, or they go to their pharmacy to get their generic drugs filled, they pay copays associated with that. The benefit to the employee is that this product allows them to be a limited number of people who are eligible to use it. So your wait times are sometimes less than 24 hours to get a, and then the other advantage then on the employer side is that we're not paying for the costs of a traditional medical facility, and and so we're carving out some of these costs. Our employees are getting a free benefit because they would not pay anything more. They would pay their health insurance. You have to be a member of our health insurance, though, to be part of this, but your family, if you have family coverage, your family members are covered from the age of 2 and up. So you can't take your infants there, but you can take your 2-year-old and up and make this your primary care. You can make it your pharmacy, and again, it eliminates copays on the employee side. We have been quoted originally when I started the conversation with Mark, we were quoted for fiscal 25 a 9% increase to our health insurance costs. We as a county can't afford to just absorb 9% across the board. So we were going to have to look at our formularies, we were going to have to look at the copay costs and that kind of stuff. We have been given an update, but it's still 6 to 7%. So our employees are going to have to pay more in both health insurance, and we are probably going to have to look at what our copays are. If our employees are willing to change their behaviors and utilize this facility, first as their immediate care, because immediate care is actually a very expensive form of care, same with an ER. If they are willing to utilize this, it saves the county money. Based on the analysis that Marathon put together for us and the cost of the contract, it would cost the county about $400,000 a year to pay for our employees to utilize this service. But they're estimating with just 38% of our employees using this, in the first year, we would save over $500,000. So yes, in the first year that we do this, we are going to have kind of double costs, but then the second year when we can show Blue Cross Blue Shield, our current provider, that there is savings, we would be able to utilize those savings to help offset our healthcare costs. Again, I am not a member of the county's healthcare, but this actually is something that if I was, I would love it. I have a couple maintenance drugs that I take. I wouldn't have to pay copays on them. I literally would be able to go, call them up, call up their pharmacy, and get my prescriptions refilled with no copay. That is a savings to our employees. I would be able to call them up and say, hey, I don't feel good. Can you get me in for an appointment? Yes, we can get you in this afternoon, tomorrow morning. Great. And I wouldn't have to pay the urgent care copay cost. I know at times it's hard to get into my own primary care provider to see them on an urgent basis. Again, part of the model of Everside is that they pretty much guarantee that if you make a telephone call, you should be able to have an appointment within about 24 hours. Sometimes that's really hard to do with your primary care. So we're here to answer questions. Part of the reason I'm asking council to consider this is I would like to build this into the fiscal 25 budget. If council has no desire for us to enter into this contract, it would be entering into a contract for Everside for our employees starting July 1st, because we would build it into next year's budget. If council has no desire for this, it's not worth my time to build it into the budget. But if council sees the value of this product, it would be something then that we would build into the budget and bring to you during the budget process. Anything that I missed?
So I would just add a couple of different things. So first and foremost, Marathon is not a health system or a health insurance carrier. So the way that these health centers work is they sit kind of as an adjunct to the main medical plan. And really, as Pam mentioned, at the employee and family member level, this is a great resource so they can get same day, next day access to care. This is not something that community members can just walk in and utilize. You have to be sponsored by an employer, in this case, you all. So it's not like anyone can just walk off the street and go have access at one of these health centers. It's dedicated to the sponsors of the health center. Secondly, we talked. Yeah.
Can you mute Joe? Thanks.
He keeps on muting himself.
Okay, thanks. Sorry, go ahead.
Secondly, you all being self-funded in your insurance, right? So that's the whole part about if we've done an analysis where we looked at all your claims, your medical claims, your pharmacy claims. And if you think about it, the Marathon Health Center is in a fixed cost environment. It's a monthly fee, the $400,000 for the year. When we are able to successfully drive your employees and their family members into the health center and utilize that at a fixed cost, instead of going out and hitting your claims because you're self-funded. You're paying every time somebody's going to one of these urgent care centers, right? And those are high-cost centers of care. So we can drive people more into the Everside or Marathon Health Center. On average, our appointments are going to be 32 minutes. We have full labs in the health center. We have generic prescriptions. We're going to have a mental health provider right there available in the health center to see and treat people. So it really is, again, a way to engage employees and their family members in their health. We're working with patients that have chronic conditions like diabetes, et cetera, that become very costly long term. And then, also saving the county money by reducing the amount of claims going to urgent care. A lot of people go to the emergency room to get their care, either for physical or mental health. This is a way to direct it all into that fixed care environment and create value for the employees and, of course, the county as well.
And then something unfortunately popped in and it's popped back out again. So the Board of Education has agreed to sign on, and we would be allowed to join in with them. We would be signing an agreement between us and the Board of Education and Marathon, as it would kind of be a three-way deal since they are an original member of this. We did not get in on the ground floor, but it doesn't vastly change the concept. Queen Anne's County opened a facility in the fall or summer.
Last summer.
In the summer. I know that Bunky toured it, and I believe Laura toured it as well. Everywhere that the Board of Education checked as references associated with Everside, they got glowing reviews, and the biggest positive that they had was, besides the savings, was that the value to the employee to be able to have healthcare access was incredible. It was actually a value added to their employees. Additionally, I was talking with HR and our HR, and they were actually interviewing somebody, and they had previously worked in Queen Anne's County, and they gave a glowing review as an employee through no prompting. It's not like they're talking to their employer or anything like that. They were asked a question, and they said it was actually a fantastic benefit to them. The Board of Education did take this to their employees, and their employees were excited about the concept. Again, we as the county would not charge the employee for this service. This would just be built into the budget so that it wouldn't be an added cost. And again, if they utilize the services of this, it saves the employee money on the copay side.
So you said the Board of Education is currently doing this?
The Board of Education is currently in the process of getting their facility up and running. I think it's supposed to start in May, June timeframe.
June 1, we're slated to open. The site is 659 South Salisbury Boulevard, I believe.
So is that on the S-curve?
Yes.
Okay,
In
so
a sense, they're kind of building their own docs in there?
so it's actually in the same facility as what was Salisbury Immediate Care, Aqua Care, right there on the S-curve. It's that health center.
Okay.
And so it's, yes, they are building their own
Standalone
urgent care,
facility. That's right.
own urgent care. It's already a fixed building, so they're just building out the inside.
Right.
But again, the advantage to the employee is that you're not going in there waiting for everybody and their brother. You're going in with just a fixed number of people that have access to this facility.
Would we be sharing the one with the Board of Ed?
Yes. And they would staff it appropriately for the additional people of the county joining the Board of Education employees.
And is it, so it's 400,000 just from us, so?
Yes.
Okay, all right.
Yes. Our share is 400,000.
Just for clarification, so this doesn't cost anything to the employees, right?
No.
We, of course, pay for that on their end. And then, so they could then take advantage of this. When they do, the county saves.
The county saves and the employee saves. Sorry, I put it on you.
Okay. And then I guess, how do we know that Blue Cross and Blue Shield, I think we're saying, I saw a $500,000 save with a 38% participation rate. Have we verified any of that through them, Blue Cross Blue Shield, or do we have any data?
Bolton, who is our healthcare consultant, has worked with, would work with us and Blue Cross, but the advantage is that it would not show up in our claims data. And because we're self-insured, unlike some employers that just buy an insurance policy, if our claims costs go down, for every dollar our claims costs go down, our cost that we have to charge goes down. So again, it is very obvious, it will be very obvious within a year, once we have our first set of claims, if the claims actually come down, Blue Cross Blue Shield can't charge us for something that's not there. So we are charged based on our historical costs and an administrative fee for them to process our claims. So if our claims start coming down based on these estimates, Blue Cross does not have the ability to charge us. Bolton is our third party that analyzes that to make sure Blue Cross is playing fair.
Also, just to add quickly, we're obviously working in the state with Queen Anne's and St. Mary's as well. We've been partnering with Care First, and so sharing of data, information, and validation of savings is all part of the relationship we've built with Bolton, Care First, and our clients.
Okay. And the last quick question is, I guess, just trying to understand Marathon or Everside Health, the business model. Is there a succinct way to say how this basically saves? Because I can read people's faces already. They're thinking, "No way, this is a scam somehow." That's gonna,
We hear that all the time. So, because people say, it sounds too good to be true. It's too good to be true. Like I said, Marathon Health, we have over 680 health centers across the country in 41 states. As part of our process, right, when we have a group, the piece about looking at the claims data, right, so to be able to provide a proposal with pricing, we also provide a review. We have actuarials on staff that run all these numbers. They look at the claims. We're able to use credible benchmarks from looking at those claims to be able to say, in a given year, we anticipate being able to affect X percentage on people that go to these urgent care centers. We anticipate to save X percentage on people using the emergency department as their healthcare center. And we're able to show, again, based on our business benchmarks, what those savings are. Further, because there is skepticism, understanding that around some of our projections, we put performance guarantees in place, right? So things around the utilization or engagement numbers, things around patient and client satisfaction, and then things like clinical quality metrics, right? Making sure that people go get their age and gender appropriate screenings in advance. So we do have a very sophisticated process that's been validated by third parties showing our calculations on return on investment and savings methodology, which I'd be happy to share.
And then just last part of everyone, this company, assuming it's first of all, is it a subsidiary of another company? Is there another, or is it assuming a for-profit business?
It's a for-profit business, yes.
What's the contract term like annually?
So
We did a 7-year contract term with the schools. Our typical contract terms are 3 to 5 years.
So we could negotiate that. I would suggest that we make sure that we do at least a multi-year deal so that we are giving ourselves the availability of seeing this in process and affecting change within our population. Again, we have employees, just like the county as a whole, that utilizes urgent care and emergency as their primary care. If we can affect change and tell them, if you go see this doctor, we won't charge you anything. In addition, you have your health insurance, but now you won't have to pay an emergency room visit cost. You will not have to pay an urgent care cost. You will not have to pay a primary care cost. The county is giving you this benefit to try to make you a healthier person.
What are the hours for the business?
So we stagger the hours for each client based on their needs. So typically, we're open at least 40 hours of operational time. So for the Board of Education, we have hours Monday through Friday I'm not sure if we put Saturday hours in, but we also have early hours some days, like opening up at 6:30, 7 a.m. And then other days we have later hours going until 8 o'clock, so we can make it convenient.
Yeah, my question is, because, they're for the employees, and I was just wondering if whatever's more convenient for them so they don't have to, like, take off work all the time.
That's right.
Right.
That's right.
So this, based on our input and ours and the Board of Education, by growing the facility with having 2 employers, it actually would benefit the employee because we would be bringing additional funds to the model, thus we could possibly bring additional hours. So both parties would benefit by the growth in hours. And again, the model is such that they're not looking at having a 8 to 5 facility. They're looking to have it with hours before work or hours after work. It may not be every day that you have both, but you have the availability and a quick turnaround of getting an appointment.
Okay.
Any other questions? Everybody okay with it? We're good?
Does council like the idea enough for me to try to model it into the budget? Okay.
Yeah.
Thank you very much.
Thank you all. Appreciate your time.
Thank you.
Thank you.
John?
Yes, Joe.
Hey,
go ahead.
John?
Yes.
Hold on.
I've got some questions.
Sorry, Joe.
I
Sure.
think you, when we put this on the agenda, it kind of lit things up a little bit with some employees. First of all, do you do CDL testing?
We can. Yes, we can.
I mean, can you or do you? Is
Yes,
that
we
set
do.
up?
We do, and we can.
So it's we pay for CDL testing now. We would pay for CDL testing through Marathon.
Okay. How about just general blood test?
Yes,
You know,
sir.
like
So
people get blood tests so many times, every 3 or 4 years or 5 years or whatever. Do you do that?
yes, sir. So we will have a lab built out directly in the health center that we're building. So individuals can go in and get, lab tests, their cholesterol measured, strep tests, all different types of lab tests we can do right there in the health center.
Okay. I see you use the figure of 38% participation.
In year
and
one.
You've got a 400. Is that right?
In year one, 38% projected participation.
And you use the $400,000 is what it's going to cost us to go in. How about if you have a 75% participation?
That means
Is that going to increase our cost
no,
over the
sir.
years?
No, sir. It's not going to increase your cost. It is going to increase the savings that we've projected. The
So-
more participation,
Yeah.
the higher the savings to the county.
So the way
Okay.
they charge us, Joe, is they charge us on what's called a per member per month basis. So basically, our health insurance population, we would pay them on a monthly basis based on everybody who is enrolled in our health insurance. So again, that estimates out to be about a $400,000 cost for the year. It doesn't matter if 38% use this, 50% use this, 70% use this. We will still pay the same amount because our population, the only growth in our population would be those who are coming on or going off of our health insurance.
Okay. I guess at any point in time, do you bill Blue Cross and Blue Shield for any of your services that you do at that your facility?
No, sir. Everything is covered under that monthly or the annual fee we've discussed.
Okay. I jotted some of these questions down because I was in transit when I was getting these phone calls. Sorry about that. I have to go through these. Oh, give me a minute. Does a county employee, Pam, this is a question for you. Is a county employee encouraged or made to use this facility?
No, there is no requirement that the county employee would have to use this. The decision would be made by the employee. The employee could decide today that they want to use it and tomorrow they want to go to their primary care. They could use it as just their pharmacy. They could use it as just their lab. We do not have to tell Marathon in any given month which employees are planning to use it. Our employees would be provided the telephone number and said, utilize this service if you want to or if you don't. The benefit to you as an employee, you will never have to pay a bill when you walk into their facility. Yes, there could be some drugs, if you have very specific, non-generic drugs that you may still have to go to a pharmacy and pay for. But they have a relatively large formulary that they are going to stock and be able to provide to our employees at no cost to the employee. So again, we will provide our employees with information about Marathon and how it can save them money in their health care, but we will not penalize any employee who decides not to use it.
Okay, I guess the other question I had from a lady that called me, would we be talking, and should we not, the council, talk to Blue Cross and Blue Shield about this program before we sign on to it?
So our intermediary, Bolton, has had those conversations. And additionally, Blue Cross Blue Shield is, again, we are not buying health insurance from Blue Cross Blue Shield. We're buying a claims administrator. We, as the county, are setting up our plan, and they are providing a service to us at a cost. And the cost is what they're getting charged plus an admin fee to do this. So are they going to be thrilled that their amount goes down? Probably not. They're also a company that, is in the business to make money and provide for their employees. But again, we as the county are looking out for the health of our employees and the cost to the county as a whole. And as finance, I feel this is a appropriate course of action to benefit our employees and benefit the county.
Well, it certainly sounds, very good. Like I say, when this hit our agenda, my phone's lit up with some questions. We had a situation, and Pam, you probably remember that a few years ago when there was some changes being made to I think it was the prescription plan. And I think you said earlier in this presentation that one of the other counties or one of the other boards presented it to their employees. I think that's something maybe we need to do with our county employees, is present this plan to them.
Well, we can, again, I brought it to council first with the idea, if council had no interest in this concept, it didn't make a whole lot of sense for us to spend time educating the employee about the concept. Again, there is no penalty to our employee if they don't want to utilize this service. But we will gladly start educating the employees about this concept and how it can benefit them and their budgets going forward.
Okay, that sounds good.
Thank you.
Thank you all.
Thank you.
Thanks a lot. Thank you very much.
What's next?
Next item on the agenda is the proposed fiscal year '24 capital projects budget amendment. And we'll wait for you.
So we are coming to council at the next meeting to present the audit. And we are working through final draft comments and all that. But with that, at At the end of fiscal '22, we ended fiscal '22 with a $60 million fund balance in unassigned. We are going to end fiscal '23 with a $74 million unassigned balance. There are two main reasons for that growth. The budget for income tax, the county collected over $7 million more than what was budgeted. And the county also collected over $7 million more in interest income, investment earnings, in because fiscal '23, when we budgeted, we have had years and years and years of very little interest income because of the interest rates being so low. We did not have low interest rates in '23, but
Charles made some very good financial decisions along with Pam.
So our interest income is generated by us having a fund balance, us having borrowed significant amounts of money over the last couple years, because until those funds are actually expended, that investment earnings goes into the general fund. And so all of those factors, in addition to departments being wise with their money, we have created another growth in our fund balance. When we came to council for the budget for fiscal '24, we again knew we had a fund balance of about $60 million, and we expected to spend about $10 million. The piece that may or may not be known by council is that $60 million that we had as unassigned did not include the $10 million. That is in a committed line item. So we had $60 million of unreserved money. We have $10 million sitting there waiting for us to spend. And we also have a rainy day fund of about $10 million. So at the end of fiscal '22, we had about $80 million available to us. Fiscal '24, we're ending the year at $74 million and have a rainy day fund and have a reserve for the use of our fund balance in the fiscal '25 budget. So
Which equals about $94 million.
we are recommending a budget amendment utilizing some of those funds for capital projects that are partly in the CIP that council has already been presented, and there are some other projects that would benefit roads, it would benefit playgrounds, and so what we're asking council is to take $5.6 million, sorry, I have to look under my glasses to be able to see the number, $5.6 million to spend on capital projects now with those savings that are sitting there available to us. If council agrees to this list, what it would mean is we would amend the CIP to not obviously include those same projects in fiscal '25 because we would have already accounted for them. So there would be a reduction in the amount that we would be going to utilize in fiscal '25.
So just a little bit more background. So with the estimation, Pam and Charles sort of thought $50,000 in interest. Obviously, based on financial decisions that were made by Charles and Pam, we now have $7.4 million in interest. So our thought is that we are not touching fund balance right now. We are literally looking at the interest. So this was revenue that we were not anticipating. The projects that were chosen, yes, are on our CIP, some of them. Some of them are based on what citizens want, what constituents have talked to you, what we've heard in the community. And so if you look at the projects, which I don't mind going over them with you, and I have the department heads here. So I don't want you to think this is just, from my office. This is from our department heads, from our constituents. Starting at parks, we know that we have some issues down at the Wicomico boat ramp. It's partially funded with program open space, and so you can see the cost that it would be from the county fund, $62,000. Marina, James, I know that you are very well aware of the complaints that have come in about both marinas, Cedar Hill and Nanticoke. We're looking to do some general repairs there, paint, boardwalk repairs, et cetera, and you can see the cost there. Shane, I know that you're well aware of the Atkins Mill Playground. Right now, we'll have about $70,000 for the new playground. We'd really like to put an additional $50,000 and make that playground really nice down at Atkins Mill. Cove Road, you all know that it has been a very hot topic right now. Right now, we have it for the fiscal 25 CIP. We would like to move that up a little bit quicker at $525,000. For Billie Jean Jackson, we'd like to enhance the safety of the park to provide lighting in the parking lot. So right now they have some evening events, and the parking lot is not lit at this point in time. Pirates Wharf, you all know, is an important part of this. We've started Pirates Wharf. We can do the funding a little bit sooner. That would include phase 2. So that's your boat ramp, the shoreline, the fishing pier, observation deck. So that phase 2 that everyone's looking forward to, we can go ahead and get started with that. Turning the page, the Civic Center, which is the roof repair. So I know in the CIP, it was sitting at $4 million for a repair or to replace the roof. Right now, when it has heavy rain, which a video has been sent to me, rain is pouring in on the stairwells at this point in time. So we want to get the roof repaired, and then obviously later on we will do the replacement of that. We just got a call in not too long ago for Westside Community Center, so we will need a new HVAC in the lobby of the community center, so you can see the cost there. We have our corrections here. These 3 projects were listed on the CIP. First, the cast iron pipe replacement. We just had their CIP meeting. We wanted to go ahead and get that done now. To start looking to take the existing room and create the program areas for the library. And then also with corrections, we would like to purchase the 2 body scanners. So these would be used to reduce the entrance of contraband into this facility. Roads, these guys are here. I don't want to speak for them with them being up here. Lee, if you want to talk about Athol Road and why that was chosen.
So we've had quite a few concerns over Athol Road from the fire department, some other people. Athol Road is something that will be happening partly, at least possibly next fiscal year, probably the following fiscal year. It's certainly not anything that we'd be able to do this amount at one time with our budget. We would be spending most of our paving budget in one spot. So this would allow us to go ahead and pave a substantial portion of Athol Road. There's portions of it now that have been paved, and this would basically what we would have is Athol Road would be paved from Route 50 to Cherry Walk Road in its entirety, excluding out a couple sections that have already been paved. So, it's certainly something we would have to do, in the future, and this would just allow us to get it done a lot sooner, make that road a lot better. So it's about 4.73 miles, so milling and paving.
I didn't realize how expensive paving was. The next thing was the airport. So an additional lane is needed in the public parking lot to accommodate passenger volumes at leap time. So right now, it would be creating that other lane and a canopy coming over that. On the CIP, you saw that Parsonsburg Library is going to be in need of some renovations. We'd like to go ahead and get started on those. And then the last thing is Wicomico County Public Schools. One of their requests was number 2 priority on their list would be is that HVAC renovation to Fruitland Primary. I'm sorry, to Fruitland Intermediate, and this would be in addition to the $4 million set aside for Fruitland Primary. So with that total, this still doesn't, there's still about $1.3 million left in just the interest. So this is, again, not touching our PAYGO. This is not touching the rainy day fund. So that 1.3, if council has any projects, we would love for us to check off that CIP. We know that there was a little bit of contention with the CIP. So this, like I said, clears a lot of that up. Maybe that 1.3 could go towards anything. I know Warwick is hurting right now. If there's other things that you all would think of, we would be more than open to that. So.
And again, we're looking for these to be capital projects, one-time funding, so that it doesn't become a recurring expense, but it does take care of possibly deferred maintenance and or projects that have high value to our citizens.
I want our citizens to see that we are taking tax dollars and unanticipated revenue and putting it right back into the community.
Questions? Josh?
Oh, really quick. I'm really sorry that there's nothing in District 4. Everything is City of Salisbury.
See that? Yeah.
Sorry. I do apologize. But if there is something you can think of, let us know.
I've already thought of a couple things, but yeah. Well, first of all, I did notice there's nothing in District 4.
Sorry.
But we still continue to hear again and again that we need to get the trash off the roads, and that not having a facility. I know it is combined with operating, but still, if we had a facility in the city of Salisbury, which by the way, or in the county, which I mean, the county and the city are, it's like Swiss cheese. It kind of, there's giant holes in the middle of the city. But if we had another space for recycling or some sort of station, even if it's not at the Civic Center, which is a great location and everyone knew that it would be there, if there were another similar space that we could use in some other area, that would be greatly desired by the citizens. And we get, you get the emails today on constantly on the daily updates of the amount of trash pulled off the roads. The more that we can have those kind of locations, the less trash we'll have on the space. And then
We are talking with the City of Salisbury for a possible location.
Very good. Okay. And then the last thing, we have on here, of course, body scanners. I've been saying it for 5 years. There's no body scanners here. Anyone could. It's only a matter of time before someone brings a gun and starts firing on people. This is the way that you see these. It's in the news all the time. We had a couple months ago. We had a judge that was done. It's local bodies of government. We really, I cannot stand this building and this facility, and I would love for us to change that, but not being able to change that in any kind of significant way, understood. But at least we can do is start to move in the direction of security, which I know comes with an operating cost, other kind of things. But right now, there's no security, and most of the other counties on the Eastern Shore have that. We are the largest county on the Eastern Shore. Talbot County has it. Others, you have to go through a security. I just think it's something I've brought it up for the last 5 years. I'll continue to bring it up. I think it's an ongoing issue, and especially in the heightened political climate, it's going to get worse. I know that comes with operating, but I'm just throwing that out there as another thing to consider.
Thank you.
Thank you.
Maybe we can add it to our budget.
Part of this involves corrections, but in 2025, we were looking at bonding part of corrections.
The bonding portion that we were looking at bonding for was the facility renovation to take one of the courtyards and make it an interior space.
Right.
So that was $2.7 million.
Right. So are we talking about not doing that in bonding now? We're talking about doing that?
No, these were in addition to that bonding. So these were on the CIP for 2025 for plus the $2.7 million worth of bonding. At this moment, this plan does not eliminate the need for the 3 projects that we were bonding for, which was the roof at the Civic Center, the Fruitland Primary, and $2.7 million for the courtyard conversion at the correctional facility.
I overall am not a real fan of any of this. I would really like to see these funds. I don't understand why we have to fast forward everything to 2024. We're in the middle of working on 2025, and honestly, I think it's a lot of. I have a lot of consternation as it is, just in reference to how much PAYGO we're spending in 2025, and
That's why we're doing this.
Well, I get it, but it's still PAYGO.
But it's unanticipated revenue that we weren't really expecting. So we were expecting $50,000 in interest and got $7.5 million. So this isn't even touching PAYGO. This is revenue that we weren't even expecting to get, which is why we're trying to do just one time.
And I understand that, but I just think, first of all, I don't know how we could possibly have this large a number of unexpected revenues, no matter what the circumstances might be. But the fact is, it's a windfall, and so, but I still wouldn't treat it as a windfall and say, oh, we have all this new money, we have free money. I'd still like to try to implement everything we can towards the basic structured foundations that we have in place, where we say, okay, we're in the middle of working on 2025 CIP and operating budget, and I think we should continue forward with that. I think the public should have that option to know, oh, my God, the county has an extra $5 million. They want to hurry up and spend it. You don't know whether there are some people in Joe's district or in Josh's district that are saying, there's always been this need I've wanted, but I've never seen it at CIP, so I guess, I'm just out of luck. So I've always felt like, whenever we have the opportunity to include the public in any type of these processes, we should be able to go to the public and say, hey, we have $5 million. My personal preference, honestly, I think my personal preference would be to sit there with this windfall, try to evaluate where we are as a county and what we're going to do with our EMS systems. maybe this is a perfect opportunity for us to be able to get out ahead of the EMS system instead of trying to kick it down the road, trying to figure out how we can be more self-sustaining with that program in Wicomico County.
Unfortunately, because we do not feel this is recurring revenue, that, if you listen to the news, the Fed is talking about cutting interest rates, which means our interest income is going to start going back down again.
So will so will our interest rate on the bonds we borrow.
Correct. But if you can do projects without paying interest, that is a more advantageous, wouldn't you prefer to buy your car for list price versus list price plus interest? This is buying projects, buying things this county needs without paying any interest on it.
Well, that's why we agreed to spend the reserves down $10 million last year.
And
We
what
ended
I'm
up not
saying
spending
is
it.
ultimately, we have not. We are not spending that down. We're building on that. And so what we're asking is utilize the funds that the county has for the benefit of the county.
Right, but with public input. Shane?
Where's the school of thought of, if we're still borrowing money, not taking that windfall or extra money and not borrowing so much?
So again, there is still that conversation, because again, when we present the budget, we can then look at, okay, if these projects came off the list, maybe now we don't borrow everything that we listed. Maybe we can now pay for it, because again, we expected to end fiscal 2023 with like $50 to $55 million. We are ending fiscal 23 with $74 million, $20 million more in unassigned, plus still having a rainy day fund, plus having reserved for the $10 million worth of PAYGO. So again, does it make sense to invest in our county for things that are needed in this county? Adkins Mill, I have sat here through public comments about a playground being needed.
And we are getting a playground.
Right, but this would move it forward and make it a more,
Why isn't it moving forward?
no.
Yes, but you're waiting on program open space. This
So-
is something that it could get started now.
So the difference would be is that you would be, instead of waiting for next fiscal year, I'm not saying it's not moving forward. What I'm saying is moving it earlier in timeline so it becomes opened earlier for our citizens to utilize, and making it a bigger facility and making it a more, having more equipment available to our constituents.
If we're waiting on open space, does that mean if we went ahead and spent this money, we would lose the open space money?
No, we would still get it. We right now have $70,000 for that in that particular project. We're hoping to include an additional $50,000 to make for a better playground. What we did is that, again, we did get community input. We've been hearing it from the West Side Commission. We've been hearing it from people here. We've been hearing it from you all sitting here as to what's important to you. And I, in good conscience, cannot sit back. And we are not dictators. We are not Louis XVI sitting in Versailles on $94 million when we have potholes and roads that need to be paved. I'm not asking to build a new GOB building, whether we need it or not. I'm asking for a road to be paved. I'm asking for the citizens' tax dollars to be utilized what citizens' tax dollars are to be utilized for. I want roads paved. I want schools taken care of. I want our marina to get a facelift. I want a new playground down in Powellville. We want Cove Road developed. We want Pirates Wharf to move on to phase 2. So we are asking for funds that we weren't even expecting to get for this year to be utilized. Based on, how many complaints have you gotten on Athol Road?
Quite a few.
Right, from public safety entities as well. So this is not just me sitting there like, oh, I want this and I want this. This is based on what citizens want. This is based on what you all want. This is what people stand at this podium and say that they want.
But it's also what we're implementing in the 2025 CIP.
That's correct, but all we've heard is how terrible the CIP looked.
Can
I
we-
think the exact wording was, this is the most horrific CIP we've ever seen. So our thought process was, we can go ahead and eliminate some of those projects off of the CIP using this unanticipated revenue right now.
Can we have a public hearing on it? Would that?
Yeah, they're all capital projects.
Yeah.
Yeah, you would
Yeah, you'd have to anyway.
That's what I mean. So can we have a couple public hearings on it so it's not like nobody had input?
I don't see the sense. I just honestly, I mean, I can understand Athol Road. I can understand the fact that we're probably looking at Warwick Community College, probably needing more funding based on the urgency of what's happening at the state level, unless we can correct it at the state level. But again, I don't see the sense of urgency with everything else. We respect every one of these departments. You know, we have corrections back here. We have other departments here. And we recognize the fact that this work needs to be done. But I just have I have a lot of anxiety about just saying, okay, here, now we're going to do this, because I don't think the council ever came to the conclusion itself that we're really that much on board with using this kind of pay-go. Because when we agreed to use $10 million out of reserves from last year for pay-go, we said, you know, we don't want this to happen on an annual basis where every year we're spending down another 10 million here and another 10 million there, whether it's found money or not. We're still trying to be responsible about it. So I just would rather be a little more structured, and I would rather dovetail this into 2025. I'd agree with Athol Road, but overall, I will repeat it again. I think the biggest thing we need to start looking at is what type of investments we need for EMS, whether we need to start making capital expenses in EMS, whether or not we're going to establish our own county system. And this would be a perfect opportunity for any newfound money.
Well, aren't you waiting for the SWAT, though, for that?
Sure. We don't have to spend this today.
No, we don't, but this is one-time, like, funding, and I
It's not going anywhere. It's not going anywhere.
I understand that, but these projects need to be done. Like, for example, the roof repair at the Civic Center, rain is pouring in on the Civic Center right now.
Why wasn't that in the original CIP? I don't get it. You want to spend
Well, it was, a new roof was.
the roof.
Right,
Now you're
but the
talking about
roof
spending $165,000 to repair the roof.
Right.
And so what happens when you spend the $4.1 million to replace it? What
Well,
happens to that
that's why we
1.6?
want, so that's one reason why we want to do it now, so we can do the repair now. And then when 25 comes, that's why it's going to be bonded, and we're going to be doing it then. There are things that have to be done. This county for too long has just done deferred maintenance, deferred maintenance, deferred maintenance. And right now, when you look at the amount of money that we have sitting in our account, which is a good amount, and and then compared to what our budget is, it is the highest percentage in the state. So I'm just letting you know that I'm getting very frustrated because we collect tax dollars to make Wicomico County better, not to have it sit in a bank account. That's not why we have it.
And we don't do that.
That's what you're doing.
We have multi-million-dollar capital improvement programs. Every year we have.
I understand that.
multi-million-dollar
This
capital
stuff
programs.
needs to be done. It's on the CIP.
When you tell me you want to spend $165,000 to repair a roof, that you are then going to turn around and spend $4.1 million.
I've said the
to
same
replace it.
thing. Well, how would you,
Replace it.
well, here's the deal. We have two options. We can let the rain continue to pour in all spring, or we can fix it and then get the new roof. So
Where was that sense of urgency last year? I mean,
So
the rain
we-
just didn't come last week.
So
Yeah, go ahead.
the holes have become more pronounced. Steve had requested that we come to council for a budget amendment for a roof repair. We tied it into this project, into this overall. So Steve has come to the administration. We are now coming to council. We could have brought these as 15 individual budget amendments. What we felt was more appropriate was to bring it as, here is all the good we can do for the county now at now's cost versus future cost, which is going to continue to grow because costs always go up.
But we're not talking years. I mean, we're talking months
But again,
before we do the budget.
so.
Why couldn't we take that money, and like he said, dovetail it in, and we may need it somewhere else. We may need to pay down a bond. I
So-
don't understand the sense of urgency.
So
There's no sense. I'll just be very honest with you. These projects can be started now. We have the money now. We can go ahead and get started now. So why would we wait 5 months just sitting around waiting for July 1st? The money is here
It would be nice
now.
if we saw the budget and started working on it.
well, sir, we are working on the budget.
Well,
Well, we'll start a budget meeting. I mean, you guys haven't even had your budget meeting yet, so,
that's my point.
right.
Again,
But why would we want to include this in the budget if we can take care of it now? Why would we roll this into the budget when these things can be checked off? That way our budget is lower than what it would be in 25 because, hey, guess what? We got this money now, and now we can take care of these projects. These are all not going to be done tomorrow. It's not like if you say, hey, yes, this is great, that they're all going to be finished tomorrow, but I can have Lee and his crew starting out there in the spring to start paving 4.17 miles of road. Why wait till July 1st when I have the money now? If you're going to approve the projects, and we're going to have some more work sessions, we're going to have public hearing, why would we wait when we have it now? Why would we sit for 4 months when we have the money now? Again, I think I must be misinterpreting how government works. We collect tax dollars, and our citizens expect us to put it back into the community in the best way possible. These are projects that the department heads have said that they need for their departments. These are things that your constituents have asked for standing at that podium. And these are things that a lot of you have said are important. So I'm having a hard time understanding when we have the money now, we have the ability to start working on these things now. Why would we sit and wait till July 1st?
And I've said it twice, but why wouldn't we begin planning right now for an EMS program?
Because we don't even know if we haven't even gotten the SWAT yet.
Exactly. That is exactly what I'm saying.
Okay,
You
well,
have to evaluate what is at play and how you're going to use the taxpayers' money wisely.
correct.
Yeah.
I'm basing it off of what the taxpayers said they wanted and what the department head said they wanted, not what, we
You don't
think
think
might
the fire-
happen
the
based
fire
on a SWOT
department, I
analysis.
think, recognize the fact that the county is really needing to address the EMS situation in this county. Josh?
Well, first of all, by the way, I appreciate trying to be, active and address the projects as quickly as possible. Obviously, I agree wholeheartedly with the sentiment. If these are projects we say we want to do, we've got the money, let's do them. Pretty simple. It's $5,615,000 comes at 80% of the amount that you've figured out. It's the $7 million that we have. So I'm assuming that it leaves a little bit of money, a little bit of wiggle room in case cost estimates creep a little bit higher, which looking at many of these, I'd like, how do you get it that cheap? But I don't ask questions.
These
Okay.
were given, these were estimates that were given from the CIP. The flat rates where you see 120,000, 75,000, they were taken right from the CIP. So could the cost, yes. But the reason that we didn't go any higher was honestly because we thought that council may have some specific things, like you just said, the security to enter the building. Can we look at those things? We knew that Warwick is in some trouble right now with CADE funding. Do we want to put it towards that? We are looking for state match with Mason-Dixon. There's going to be a county part of that. So there's other things that have come up that money may be utilized for. And I'm just a little frustrated to have to wait till July 1st.
I think part of that frustration, by the way, and which, understood, but, maybe 4 years ago, the council put together its own strategic plan for the county, separate from what the county does in a comprehensive plan or other kind of, the current documents that we have to go off of for future planning. Right now, we have the CIP, which is, obviously just a year plan. It's a planning document, but we don't have a whole lot of other planning documents. And to the council president's point, it'd be nice to be able to figure out where these other seemingly nebulous issues of whether or not we go forward with a county EMS or whether or not we have put more money more immediately into sewer and water expansion. But so not having that document, not having a strategic plan for the county to say, hey, over the next 3 to 5 years, these are the priorities that we care the most about, and having only a limited CIP as that document, I think that's where the conflict arises. But nonetheless.
These are projects for 25.
Correct.
And so therefore, I didn't look at anything futuristically.
Understood.
We literally knew that this was coming in, $7 million unanticipated revenue that we got in, and I wanted to put it towards the 2025 projects.
Yeah, and
So
I think that's a perfectly, personally, I think that's a fine thing to do. If we've got the money, we've got projects that need to be done, let's knock them out. Whether or not Athol Road is the right one, which by the way, I grew up on Athol Road, spent 23 years of my life there. I'm glad to see that updated. I don't know whether these are the right ones, but I do appreciate the process to try to go out and ask the public or to find out, hey, are there other things that we need to do? I know you've had already had a public hearing, was like 2 months ago or something like that on this. I'd love to be able to have a continued public outreach, but otherwise, if we've got the money, let's spend it. Let's get them done. And by the way, a last point on this, I mean, just the $74 million unassigned balance, not mentioning all the other money that we have. I ring this bell 1,000 times over, and I'll do it again. The state of Maryland is paying attention. That disparity grant we have isn't guaranteed every year. So we do have to spend those funds, but I think we do need to do so in a more diligent, thoughtful process. And maybe there's a missing document that we're needed in here to be able to help us so there's not so much conflict. But if we got the money, spend it.
John?
Go ahead, Joe.
Julie, I understand your frustration of having money and not being able to spend it. I have that same situation when I want to buy something and my wife says no.
Well, I think it's a little bit different because I think citizens of Wicomico County are expecting more out of us.
Well, wait a minute. I'm being lighthearted here, just chatting, okay? The big problem here that I see, and everything on your list, I guess I can say I agree with needs to be done. But, the county's been following a process for a number of years with a CIP plan, and that's where this money should go into our budget. And then we figure out the CIP plan, or the CIP budget and operate it the way it should be. And that's what we've done for years. If you have an emergency come up, then we dip into our fund, our reserves, and we go that route. I understand, John, talking about this EMS thing that we've got to face. That's a very important thing. But what I really want to dwell on is a few months ago, Johnny Mounts sat at our table and said, watch out of what's going to happen from the state. Now, we've already heard that we might get our disparity grant cut. Warwick's been in front of us, and they're nowhere near finishing their budget. We don't know what else is going to happen, whether it be education. We just don't know. And having that reserve fund is important. When you come forward with this extra money, let's follow the process, the proper process that we need to follow to get things done in the county.
I agree. I just think that the last time that something like this happened, when was the last time that the county got unanticipated revenue of $7.5 million to the point where, there's only so many times, Joe, that you can hear this CIP is terrible. This CIP is the worst I've ever seen. So in my mind, why not alleviate some of those CIP projects? Therefore, they can get started. They're checked off of the CIP, and therefore maybe the CIP is a little bit more manageable. So I apologize that this is not the way things have always been, but I don't remember the last time that the county got an unanticipated amount of $7.5 million based on one financial decision, under an executive. And I'm not tooting my own horn here. I'm trying to say to the citizens of Wicomico County, hey, guess what? Based on a really great decision that was made, we're not going to touch the fund balance. You're still going to have $74 million sitting in the account, and we're able to still get all of these projects done.
I'm still not sure about this whole revenue issue being some fantastic example of, management or financing or anything like that. To me, it's just an oversight that occurred, which we're now seeing a very strong benefit from. I don't look at it the same way. Still, I think that this is something we need to put into 2025. we're in the middle of trying to figure out what the heck we want to spend in 2025. And now you're talking about going backwards, and now we're talking about filling in these needs in 2024.
No, I'm not going backwards at all. I'm actually trying to go a little bit faster than in 2025. And I'm trying to take, instead of having you have to make those hard decisions as to what's going to be funded in 25, I'm trying to fund all of this. So therefore, 2025 is way more manageable.
The whole process could be more manageable. We don't need to spend multi-million dollars in February of 2024 to make our job easier in the CIP for 25. I'll be fine with working on 25 when it gets here. We're still in the process of that, and I'm fine with that. At the same time, to allow it to dovetail with the operating budget, we'll have a much greater idea of where we are as a county.
Do you all agree with that? Do you all agree that we should wait 4 months when we have the money now, that we can start paving, that we can start getting these things in order? I have a hard time. I mean, I don't know how you go back to your citizens and say that. I really don't.
It's not that we're saying no to these.
No, but you're saying wait 4 months. We have the money now, but wait 4 months.
I'm okay with waiting. I'm okay with.
That's a shame. I bet you your citizens won't be.
May I finish?
Sure.
I'm okay with having $74 million in the reserve fund. We've got a landfill that's falling apart. We've got a water sewer master plan that we're trying to implement.
We have $94 million.
There's a whole lot of expensive projects that we have looming ahead of us.
Unfortunately, the $74 million cannot be touched for the solid waste.
Okay.
It is a totally separate set of funds.
Point is, we have a lot of very expensive projects ahead of us. Every one of these items on this list, thumbs up. Let's just wait. That's all.
May I come back to council with a budget amendment for fixing the rain in the Civic Center?
May I ask, okay, so some of these projects really are needed to be done, like the road and the roof, and maybe I think the boat ramps, the boards are falling off, people could fall in and hurt themselves and drown. Actually, we need a ladder.
Well, hopefully we can just wait till July.
No. Well, I'm
Hopefully it
just
won't
saying, I
happen
mean,
in
this
the
is the
spring.
time to do it before the season starts.
Right.
But is there maybe something where we can amend it so we can take some of these more pressing, prioritize it so we're not nixing the whole thing? I don't want to nix this whole thing. Some of this is important. It's all important, don't get me wrong, but I think some of this we should prioritize if we're going to compromise. I think we can maybe pick a few of these that maybe the executive feels that they're much more pressing than just all of this.
James, I don't want for it to be the executive.
No, well,
no, listen, I got these from the department heads,
Right.
and I got them from you
Yeah.
and from the citizens.
Okay.
So if the council has specific ones that they feel are pressing, for example, like, the water pouring into the Civic Center, that's fine.
Yeah.
These are not my project. I'm not benefiting hardly personally from any of them.
I didn't
So-
mean to make it, I meant to say, well, the administration, they keep it
Yeah.
general. But if there's something maybe that's more pressing on this list that we could ask the executive to push forward on, like the renovations for the library that doesn't need to be done, right? We don't need the additional lane canopy cover. The body scanners, they're needed, but do we need them right now? The library could probably wait. The cast iron pipes could probably wait. The west side, community center, it's getting ready to be summertime, right? July is going to be hot, and if they don't have AC in that unit where we just approved for some people to have programming there, they're going to want air conditioning. So I would think we would want to prioritize with the HVAC with the west side, the roof repair, the boat ramps, because I'm an avid fisherman, but I go there and I see the boat ramps, and like I said, it's not the safest. So I could see 4 projects out of all of these projects that we could prioritize and maybe make it not so much of a big bite. I don't know if anyone else is maybe wants to compromise with that or not, but that's what I would like to do.
When do you start paving? April?
So the thing with this is when you're adding this much onto it, there would be a possibility if we defer this until next fiscal year's budget, realistically with the way, you basically have Allen Myers that pays everything in this whole area. So we're to an extent dependent on their schedule and when they're able to fit Wicomico in around all these big state projects. If we tried to defer this, we certainly just in our normal paving budget, we would never be able to do this amount. But if we deferred it the next fiscal year, more than likely it would be next spring before this happened, because we have a very small window in the fall, and then the plant's closed. So if they could squeeze this in amongst everything else. If we were able to do this now, and I let them know this, then they could figure on doing this as spring work. It might be the tail end of the spring work, but if it went past July a little bit, we're okay because this is set up as a capital project, not an operating expense, so we're not cutting off 630. So that's why I think it would be super advantageous to go ahead and, if I was able to say to them, hey, look, we've got this extra money, go ahead and put us in your schedule, while you're still here with us this spring before you leave us and you complete our existing project. That's the way I'm looking at it. And I mean, that may be kind of the same way that some of these other projects are. If I pushed it to next fiscal year, it would likely be next spring before they got to this. So it'd be over a year away.
Had you put Athol Road in the 2025 CIP?
No, it would be in our operating, so it would be in our paving schedule.
Or either way, had you scheduled $1 million for Athol Road for 2025?
Not the entire amount, but a portion of it's already been factored in next year's paving schedule as far as preliminary. I mean, we're still looking at finishing out the current paving schedule that we're in. So it would be something that would be in FY 25's paving schedule. So we're still in 24 because they've only paved a small portion of our current fiscal year paving. The bulk of it will be done in the spring. So yeah, that would have been added on, but I have never put that much into one road, but because we have the ability to, and because it needs it, instead of just constantly piecemealing, we could get something very, the whole thing done. And
Joe, as long as I've known him, he's always asking roads if they need more money.
Yeah.
I know that. Steve, I have a question, if I can get my head around this $165,000 on the roof repairs. The one thing I appreciate is trying to deal with emergency maintenance situations. Yeah. But I guess, is this a situation we're at a point now where we have to spend $165,000 for a roof repair, and then we're going to simply just rip that whole $165,000 job off and put a whole new $4.1 million in?
Yeah, unfortunately, that's more or less the case. We've the roof repair at the Civic Center has been on the CIP for 5 to 10 years. It's been something we've continued to defer. The executive's right. We just got a kind of a patch job done, but for the last almost 3 weeks, we've not even been able to use the stairway because there's been water pouring through that, so we've had to use the elevator. It's been something we've continued to patch, and it's not ideal. Obviously, I understand the concern. You don't want to invest money and then rip it out. That's not what we'd want to do, but unfortunately, we've waited so long at this point that that's the situation we have. And it's not going to get better.
What's the total cost of fixing a roof?
$4 million.
To replace it was the $4 million in the CIP. The 165 is a quote that we got to repair the.
I mean, this is just a thought.
It's a good
But
thought.
instead of spending the 165, why not just use that money that we just found and just approve the roof? Instead of wasting $165,000 of taxpayers' money, if we know we're going to spend.
You have,
So
you have
it
an
would-
immediate issue, right? That you
So
have,
you could, and the issue is going to be is that we have an immediate issue that we could get somebody out in the next week. To actually replace the roof, we have to go through the whole bidding process, which is create the specs. We have some of that already started, but then you have to put it on the street, you have to wait for bids to open, and all of that time, it is not ideal to patch a roof that we need to replace. But I've been with the county now 10 years, and we've been talking about replacing the roof. We never knew when the county was going to have sufficient funds to be able to do the roof. And so we have.
Have we ever?
Yes,
I'm sorry.
go ahead.
I thought you were done.
That's
Have we
okay.
had more than one price on patching the roof, Steve?
No, we used the county contract to get the pricing, but we could certainly get other pricing, but we used the county contractor.
Yeah, we have, with certain services, we have a contract that we bid at the beginning of every year to allow us then to go to a roofer, go to an HVAC company, those kinds of things, so that we don't have to, on these emergency situations, go out to bid. Sorry. Go out to bid.
I think it would be a good idea to get a couple of different opinions on patching that roof. 100. I know you're saying water's running in at the stairwell, so apparently your leak is happening in one certain place. And I think it would be advantageous to get a couple different opinions on patching that.
So, yes, we could do what you are suggesting. We could take the $4 million, and it would save us that we would not be borrowing those funds. But it would not be able to be an immediate fix, like we could actually fix the roof. Now,
How long? I mean, 90 days?
it's probably at minimum 60 to 90 days, because you have to we have most of the specs probably, but we have not written the document. Because we've had roofing things studies over time. So we can pull some of that information now, but then you have to, with a project this size, you typically have to have it on the street for at least 30 days, because you're going to want a point in time where people can come out and actually see the roof. You know, what are they bidding on? And then a question and answer period historically is what happens with these major projects, because you give a set of specs and they then have questions as to, well, can you do an alternate product? Can you do this? Can you do that? And we as a county then have to be able to respond to that. So minimum on the street is 30 days, and then you have to negotiate the contract, get them mobilized. So best case scenario is probably 60 days. That's assuming you can get a contractor to come in 60 days.
So we couldn't make it 60 days to save $165,000?
If we had the money to do the full roof sooner, I think that's better than flushing $165,000. I think the problem is we continue to patch it, and every time we have these bad storms, it's in multiple places too. So I mentioned the stairwell to the offices, where we've not been able to access those for over 2 weeks, but it's happening in other places in the building, so it's not just one problem spot. So we patched the one so that we're now using the stairs. But again, these things are popping up everywhere in the building. So the 165 was an evaluation of the immediate needs by the county contractor. If we could do that quicker and do it more wholesale, that, from where I sit, that's a great thing. But that's not obviously my decision. But I think at the bottom line is we have issues. We've known we've had issues for many years. So.
The issues are coming to a point where patching is no longer an option.
So this is a project that I think we're all committed that's going to be fixed within a year. We've got $5.6 million. It's a 4-point what project?
7.4.
No,
The project, I think, was 4.1 in the CIP.
yeah.
In the CIP, I believe.
I think it was $4 million in the CIP.
4, okay.
It was $4 million flat in the CIP. So you've got $4 million in the CIP for that. I wanted to add on a little bit, if I can change the subject slightly, is back to Lee's comment of Athol Road is in the operating budget for fiscal '25, just not that much of Athol Road. This money would allow us to do a much longer stretch and get Athol Road paved in one time, and not have to remobilize 3 or 4 times to get 4.7 miles. As you said, HVAC for a facility that we just agreed to rent, yes, it's only $16,000, but it's still $16,000. That was not anticipated. That one is not on any CIP. That is one that they don't have the funding for in their budget, and we are coming here. And then
Look at this. We do $1 million for Athol Road, the HVAC for West Side. As James suggested, the Wicomico ramps, and then we had the Civic Center roof.
I think it was the Marina facelift, wasn't it?
Yes.
It was the 125 and the 75, I believe, sir.
Right.
And then the Civic Center roof at $4 million.
No, the $4 million, I guess, is what we're looking at, just to see, we're going to see that being bonded regardless, right?
Well, I mean, again, council can make the decision that we don't have to bond, that we could utilize funds in our bank account and avoid paying interest costs.
I thought there was a problem with that because we had to sit there and worry about the bidding out the cost of the.
Well, I mean, again, you're either
I'm
way.
looking at the immediate fixes, right?
Well, but either way, so we could do the immediate fix of the one, whatever, 165. Or we could do the 4 million, and yes, it would be 90 days, and we would be kind of chasing for 90 days, but then we would stop chasing. If we wait till July 1, as you know, with any bonding process, you're looking at not being able to start bond projects typically until October or November. Because bond projects, I have to have the funds in place. We can, if council is moving forward with bonding, we can start the bidding process in concurrence with us going out to bond. But the earliest we could do a wholesale roof replacement for the Civic Center would be probably November of this fall. Versus 90 days from now, if we decide to do this now. Again, that takes something off of the CIP going forward. It does take something out. It takes $4 million worth of funds, but it means that we are not paying interest at the current interest rates when we ultimately borrow. There is a trade-off there.
The roof at the Civic Center is not going to magically fix itself. It's not going to get better.
No.
It's only going to get worse, right?
Yes.
Okay.
Yeah, we have hoped magically that it would fix itself in the 10 years I've been here. I have yet to find that magic wand. I wish I had found it.
Thoughts and prayers.
Yeah. I lived over there for 8 years, 7 years. I looked for the magic wand. It wasn't there.
Just so it said, obviously, I know that I would love for our county to really embrace not getting to the point where projects are so bad that, you know, that the negative things are happening. And I know that we've had a very, we as a county have tried to focus on making sure we had a good, strong fund balance for various reasons. But, you know, it wasn't that long ago that we had planes landing in the middle of the night and there was no lights on the runway. You know, things like that we knew were an issue for so long. And of course, I know I'm not blaming anyone here. That's long before many of the people who have ever even worked here. But nonetheless, I think the culture of our county, I sure hope we continue to say, okay, let's be very serious when these are serious problems. We're likely going to be, because we're losing, you know, we're about to flush $165,000 down the toilet. You know, that's just one project. There's probably plenty of those kind of situations in a given year. So as a whole, I think we would love to see us kind of address that, just so it's said.
So we're looking at, I mean, if we're really seriously talking about using the 4.1 from this as opposed to bonding, and that's the route we're going to go, and you're saying we're not going to do the 165,000, is that right?
Correct. It would be,
So-
if I collected the list right, it would be 4 million for the Civic Center roof, 1 million for Athol Road, 125 for Cedar Hill, 75 for Nanacoke, and then 17,815 for West Side.
5317. That's 5,317,000. And you were saying that if we were to take that measure, these amounts would be reduced in the 2025 CIP?
So the 4 million would come off the 2025 CIP. There would not be anything for the million because the million would be in the operating budget, so you would not see that coming off the CIP. I believe the marina facelifts would be coming off of the CIP, both of those.
Yeah.
The 17 was unanticipated, so that one was not something that was on any CIP. So basically, 1,017,000 would not be coming off the CIP, and 4,200,000, if I counted right, would be coming off.
Yeah.
I'm okay with that,
Workable.
if we're going to make that happen.
Okay, Shane? And then we have the whole battle all over again on the 2025 CIP on how much of PEGA we really want to see taken out. We're going to be revisiting that completely. We're reducing the CIP bonding, which is a good thing because we're still in a high interest rate period.
Well, we won't have to borrow for the roof,
That's what I'm saying. We don't
Yeah.
have to worry about that
and
bond.
that gets that done.
Yeah,
But
it
we
would get
still-
it started and possibly even close to being finished before winter hits
Right. I just
for the
don't-
next year.
I just don't want to lose sight of the fact that we still have to make sure that we're addressing the high degree of PEGA that we're doing right now. Because it's 30% right now in the CIP. Traditionally, the CIP is about 10 to 12% CIP is usually PEGA. And we're at 30% right now of spending cash.
Okay.
So,
It seems like this whole list, the most urgent thing is the roof. And you're saying it would be, if we approve this, it would be November?
So what I'm saying is that if we approve this, we would be I don't know how long it takes to make a roof at the size of the Civic Center. What I'm saying is versus a November start, we should be well and truly underway, if not close to being done, for a November. I have no concept. I can't tell you if a roof that size takes 2 days, which it doesn't, or, 2 months. But I can tell you, we would be accelerating the completion of it by the 6 months of not waiting for funding in November.
And the best time to replace a hot roof is in the summertime. So if it takes them until April or May to get started, that's a good thing.
Everybody
That
good?
way they'll be working through the summer on the hot roof, which is a good
I'm
thing.
good, but I don't feel good about it. I'm good, and I think the Civic Center, to save that 165 is a smart move.
Yeah.
But I think the rest could have waited when we had a better look at the budget. That's just my opinion, but I'll go with it.
Well, we still, now we're back on track, at least trying to reevaluate the CIP.
Well, it just changed things
Yeah.
So
later.
since this is just capital, it's a 1-week advertisement, correct?
Yes.
It could be on the March 5th. I can't remember what day. So March 5th meeting, we will get that to you for a budget amendment for that.
All right, thank you very much.
Thank you.
Thanks.
Thank you.
A motion to adjourn so we can go in closed session?
So moved.
Moved. All right, second?
So moved.
Favor? All right.